I'd like to call a meeting to order. We do have a quorum. And you also have received minutes. Is there any addition or correction to the minutes?
I make motion we accept the minutes as written.
Second. Second?
Second.
All in favor?
Aye.
Opposed? Okay, the minutes are approved. And I think apparently, Doctor, we have no, pardon?
Do you need to approve the executive
Oh,
session?
we do need to improve the executive session.
Yeah.
Minutes separately.
Okay. And I think we met, we'd entertain a motion because we met for discussion of job evaluations of individual employees as permitted by IC 514-1.5.6, parenthesis B, parenthesis 9. So I need a motion to accept the minutes
So moved.
of that.
Second.
All in favor?
Aye.
Opposed? Okay, they're approved. So, Dave, there's, I guess no news is good news on
No
the.
news is good news. There really isn't anything for him to report. Statewide dashboard on COVID is very, very down. Wayne County is even lower than that, so we haven't had a case reported to the state in over 7 days for COVID-19. So we continue to offer the vaccine and the booster, the bivariant booster, and encourage everyone to do that. The vaccine group is still looking into the reformulation, and if there will be a fall dose that will be recommended. That there's been no.
And they haven't made that up yet for the fall.
They said that they do, that they have the formulation ready to go into production. It's just those groups have to meet and approve the formulation and see that it's necessary to have that reformulation for the fall. But we're knocking on fall's door, so
Okay.
I would hope we get an answer pretty soon. You want me to just go ahead to buy?
Yep.
Okay. We had our first Community Health Coalition meeting yesterday that we went over the budget that you guys have already seen for the Health First Indiana Fund. We went over that, and we also went over our strategic plan of how we're going to be meeting core services, and that 2024 is where we're laying the tracks down for 2025. It's hard to project out what 2025 is going to look like. There's still a lot of moving pieces. One of the big moving pieces is what amount of continuing funding will the council fund us at. So it's hard to project out what we'll be able to do in 2025. Will they drop us down to their 20% match, which would be, I thought I brought that with me, 330-some thousand, don't quote me on that, but that would be a 20% match for the state, which would reduce our 1159 budget by over $400,000. That money would have to be moved then into the new health funding account, which would cut into programming and different things that we would be able to fund through that. So those are discussions still yet to be had, still yet to know what the council's pleasure will be as far as their commitment to public health. We would hope that they would continue to fund us at our current funding level, because, really the Health First Indiana Fund was set up to increase public health funding in each community. So we would hope that they would value public health and continue to fund us that, but it is at their discretion of what they're gonna fund us at. It can be reduced down to at least that 20% match.
The meeting yesterday was it to present the budget or to get input on the budget, or your plan, not budget, your plan?
It was more to, and Amanda was there, so we brought a lot of our community health partners in just to discuss and let them know, that this is what we have. Not a lot of input on this budget, but there will be a lot of input in 2025. 2025 will be where the Health Coalition will look at, where are some gaps in services, where are things that the health department could stand up other programs. The health department isn't going to do all of this. We will do this by offering, RFPs out there for a Vivitrol program. Who could do that, and how much funding would you need from the health department to do that? And that clicks that core service. So, those are kind of the discussions that we had yesterday at that. And Amanda, please feel free to
Right, yeah,
put in what you felt the meeting was.
right. I was impressed with the presentation of material that you guys shared with, in regards to and I'm struggling with the name of the Indiana, the Healthy Indiana.
It's
Health
First Indiana.
Okay, there we go. Health First Indiana Plan. So
HFI.
yes. And the work that you have done to help develop the key performance indicators, and then really having an insight around what those services would look like for to meet those key performance indicators. I think you guys did a great job of presenting it, and I think there was a lot of good discussion around what services are already taking place in the community, and how can we really kind of investigate and determine where the gaps are. So I think I think there's good discussion to come.
Yeah. And linkage to care is one of the core services that we have to have, and that's something that the Health Coalition will meet at least biannually. That's under SEA 4 that we do that. And so it's not just the health department's plan, it's the plan of the health coalition, the Community Health Coalition. So Wayne County is speaking in one voice for health. We have one vision of getting down there. Instead of being so siloed and everything like that, we'll have a coalition that says, here are the top 3 leading causes of death in Wayne County. What are we doing to address? I can tell you right now, smoking related to respiratory failure and heart disease is, always on the death certificates. If it's a heart attack or lung problems, I always see, smoking as a secondary cause, or smoking contributed to this death. So, looking at statistics and coming at it from a statistical point of view, founded in scientific facts, why did this infant die? We're seeing in our fetal infant mortality review teams that, so often the mother has had chlamydia at some point during the pregnancy, and that it results in a stillbirth. So focusing around what is causing the deaths from a scientific and proven reasoning and rationale of doing that.
So this year's budget is a health department budget, developed and designed by the health department I'm sure you talked to the state to do this. And next year's budget is going to be a coalition-led budget?
Yeah, it'll be very much input from the coalition and a lot of contracts given out to places that are already doing it. You know,
Was this the coalition that met yet, was it yesterday? or
yeah,
last?
yeah.
It was yesterday?
It was yesterday. Was that only? No, it was Tuesday.
Tuesday,
It was
you're right.
Tuesday.
This week's gone by
Yeah,
fast.
yeah. So it
Yeah.
was Tuesday.
And
Um,
I would also share, I believe there's great community support and excitement around the health department's decision to expand and support the paramedicine program. So I think that decision and moving in that direction is really helping, it's gonna be a great benefit to the community, so
Yeah.
I'm excited about that part of that.
Yeah.
And that will happen in
So-
2024.
Yeah, that will happen in
Yes.
2024.
Okay,
So, yeah, is it a health department? Yeah, I came up with this, but I talked with key stakeholders, you know, what do you want to see, you know, with this? And the number one thing, you know, is, you know, the mental health crisis that we
And
have.
that's not our
So-
expertise, that's.
No.
Okay.
Yeah.
No, and I'm not looking to be,
Good.
you know, a counseling service and things like that. So standing up and supporting that, just like, you know, that paramedicine program, you know, but part of, you know, their RFP will have to be that they don't just service Richmond, it expands it to the whole entire county.
Okay.
It's now county-wide, if they accept this funding, through the health department, then every citizen of Wayne County will benefit from, the money spent.
So, I'm trying to figure out how many, is
You're looking at the fever budget.
that
That's
different?
different.
Okay, all right,
I presented this to you guys a while ago.
well, that was last month's budget, okay. All right,
Here it is.
I've got it.
Oh, do you?
Can't get your acronyms right.
Okay, any more comments or questions on the Community Coalition update meeting? Okay, immunizations A to Z, that's an education program, it looks like.
That is, we're really happy to be able to be asked to host this. This is a statewide program. They come in, they do the training. It's for school nurses, it's for anyone that's giving vaccinations. And so, you know, it's called immunizations A to Z. And it's a great training for people, whether you've been doing immunizations for 20-some years or you're just starting out. It's a good program to have. And we're working with Reed Health to hold it there at Reed. About 100 people will be able to attend this meeting, and they'll get continuing education credits. Of course, my staff will go through. We'll invite the regional health departments, you know, in our District 6 to also attend, and, you know, physicians' offices, anyone that has a VFC program, and anyone that offers any kind of immunizations are welcome to attend this excellent training. And that was I just wanted to let you guys know about that. I believe we have it tentatively scheduled for September 15th. But it's somewhere there. We're trying to secure Lingle Hall for that. And then we'd like to work with Purdue. They have a training. It's kind of a three-tiered training that they can tailor. But the one that we were interested in, that Becca had found out about, is this health equity training for health department staff. And it helps you to identify inherent bias. It helps you to identify sensitive cultures, not only with the public that we serve, but within the department ourselves. That, you know, we are sensitive to, you know, different things that may cause issues or hurt feelings or that we're not being culturally sensitive to someone regardless of race, color, religion, creed, sexual orientation. So we think that this would be an excellent program for our health department staff to go through, whether they're a food inspector, going into restaurants, understanding the different cultures that they go into, where they're going into different establishments, or you're a housing inspector, or you're part of the clinical staff. We deal with all the people in our community, and we want to be able to identify where, you know, inequities may happen and address those, and make sure that we're reaching all of the population that we can reach, especially with our clinical services
Now, is
and
that,
preventative care.
is that an in-house?
It'd be an in-house.
It's brought
Yep.
in-house? How many sessions?
Right now, we're just looking at the one, although there's another training that could be a county-wide training, and have talked with Kim Clauser about that, and maybe it would be a department head training,
But right now, this would be the health department?
just the health
And
department.
it's a one-time
It's, yeah,
And the cost
Session.
of that,
0.
somebody else is paying, somebody.
It's under their grant. We're just a deliverable. But I couldn't get it reduced down any lower than 0, so. And then, if you guys are okay with us going over that
You
training,
need a motion? Do you prefer a motion?
I kind of prefer a motion. I don't think we need a motion on that, but I mean, it's kind of falls under, you know, the daily running of the health department.
I said, well, the fact is, it would entail cost, because I assume we're paying
Staff to
their
attend.
Yeah,
staff
yeah, yeah.
to attend this meeting, so.
So moved.
Is there a second?
Second.
Any discussion? All in favor?
Aye.
Aye.
Okay.
Opposed? Okay.
Thank you. Very quickly came up the application, and with less than a week notice was the safety pit FEMA grant. We already have that. We would like to reapply for that and keep that going. There's a little bit of changes to this. Currently, the FEMA safety pit grant is, we contract with Heartland Community Services to administer that grant. And I'm asking and have budgeted to make these 2 staff people health department employees. So the budget does include their fringe benefits. But we're already doing this. It would just be a continuation of our programming.
And that's easy to do?
Well, no, it's not.
So it's no new people, it's a program we're already doing.
Yeah.
It does entail moving from one contract, its position to another.
And
Or
they're
will.
going to be
It's-
employees or contractors?
Right now, they're contract.
Right, are we going to hire them, is that the recommendation?
I think you told me initially the recommendations that we would contract them.
Okay, well, why
But would
would we
pursue.
pay fringe
but
benefits on a contract?
Pursue to having them become employees.
Yeah, until we can get this passed through the county and have the county employees, they would be contract positions,
Individually, as opposed to through Heartland. We
individually.
do not have a non-compete with Heartland.
No.
So the information on fringes is actually there for if they approve making them employees.
Yes.
So initially what we're doing is just renewing the contract in contracting the two people involved, ourselves.
Individually.
Individually.
Part of.
Any further questions? I'd entertain a motion to approve the grant.
Yeah, so moved.
Second.
Any further discussion? All in favor?
Aye.
Aye. Opposed?
You are supportive of making those county employees.
Christine, do you have to submit that grant before you're going to be able to meet with council and commissioners on it?
Yeah, it was already due, so I've already submitted
I just want everybody to understand it. And that's fine with the policy, because there are situations where council or the commissioners need to approve the grant application, but the policy itself contemplates that there will be situations when the deadline is so tight that it needs to be met, and then in which case she will confer with and get approval of commissioners and council. But that'll come before either the award letter is received or the award letter or the award is accepted if granted.
Right.
They still will have that opportunity for their approval, which they have to have. If there's a personnel implication, or if there's a significant cash flow implication on reimbursables.
So what's the plan? Let's say the council would prefer not to make them county employees, and we would proceed to continue them as contract employees?
If that's the council's pleasure.
And what does this grant do?
And I could adjust the budget. The state has no problem with me adjusting the budget. I could go back to them and say, the council denied my request to have them, so I don't need the fringe in this, and they will readjust the budget, understanding that these are tight, things that, I've had to apply before, going through all the proper channels, and it's very laborsome to get a county position approved, new positions approved through the county. So I understand that.
The acronym FIMR, basically, what does this grant do? Is it?
So that's FEMA, Fetal Infant Mortality Review.
Okay, so
So-
that does mortality,
Yep, so every time, after 20 weeks of gestation, before their first year of birth, if a child dies, we collect all medical records on that and gather with a group of well, Dr. Ryder sits on it, and some CPS people sit on it, and we review, what happened. It's not to place blame, it's to find, was there a place where there could have been an intervention that happened that would have changed the outcome of this death? Similar with the SOFA review team and the child fatality. So, but the femur is from gestational period of 20 weeks to 1 year old. Over 1 year old, it's childhood fatality review team, and then anytime
many
there's
do
a
we review
suicide
a
or an
year?
overdose.
For this?
I
30, 50?
we're supposed to be doing 30 a year.
Couple a month, 2.5 a month.
Yeah.
Is this a program director who only does this? Or,
There's one person that is the program coordinator that does the FEMA, collects all of the records surrounding that, visits from the doctor during the gestational period, any abnormalities that happen or caught in an ultrasound or amniocentesis. It's reviewed, reported, and then the team just talks, where was there lack of family support, Was there unstable housing? You know, was there drug abuse? Was there, you know, what were some?
And they do all of this research without the committee and they report to the committee.
Yes.
Yeah, I can
Yes.
tell you what, basically, they do a family history, a genetic history, a medical history, all available records, a follow-up history, what happened after the event, both for the mother and the infant. Then there's a protocol that the state's outlined that we have to follow. And the state has very specific questions that have to be answered, because I think the state's trying to see, can they fit a pattern? I mean,
Yeah,
I
sure.
mean,
Yeah.
it's from a public
Gotta have
health,
the
because
data to
it's
do it.
really an early stage of attacking our higher than national average infant mortality rate. Well, if you're gonna attack a problem, you've gotta know
Yeah.
what is the problem, other than just that there's too many of them who are dying. So it's kind of in the early stages. I mean, frankly, I mean, it's gathering information, and the problem is that really we're reviewing cases that are usually 2 years old.
Really?
Yeah, because it takes that long for our system, for everything to percolate through the system. Because it's coming out of the state. But what you should know is that any infant under this definition who dies, whose parents are resident of Wayne County, that's a Wayne County death. It doesn't matter that it happened in Marion County. It's a Wayne County death. So I think it's a valuable program, and it's one that you know, I'd like to see, you know, actually enhanced, and I'd like to see our data systems improved.
I was gonna say, after we do all this, does the state give us any, how long have we had this grant?
2 years.
Has the state given us any statistical feedback? I mean, we're feeding the beast, which is the state. Are they helping, are they giving us any of this feedback? Last year you had 22 and this is what we found, or is that not?
I haven't seen that data, but I could ask for that data. And then the other position in there is the safety PID coordinator, and they work with their primary focus are mothers at risk of abusing drugs or are abusing drugs, and making sure that they have the resources that they need, try to get them into some kind of recovery works, or, you know, stop using while they are pregnant. We have safe sleep sacks, packet plays that we give parents for safe sleeping. We work with all the doctor's offices in the region that we cover to have information about count the kicks, safe sleep habits, and other things like that through that program.
Okay, anything further on that?
It's been a very successful program.
And just to confirm, the funding that we're requesting will cover all salary, benefits, fringe, so then the county is not incurring those costs.
Correct. Other than I think there's a.
No direct wage related
Okay.
cost. These are full-time positions, are they?
Yes.
So they would be eligible for participation in the county's health insurance fund, which is a self-insurance fund. There's no way of predicting experience in that individually, I mean.
But the budget does cover the.
The county contribution.
Yep.
Okay.
We calculate that at the highest premium, which would be family coverage,
Okay.
so.
So when you mention like the pack and play or anything like that, so where does that, I don't see anything in here for those kind of things, is there, or am I missing that?
Or
So-
just resources that are offered.
Yeah,
from the
those-
grant.
Oh,
the-
there's equipment, I see it now.
Yeah, and the state sometimes provides us with those. They get a grant, and people that have these programs, they come and drop off 20 or 30 pack and plays You know, we would like to start covering car seats as one of the things that we haven't routinely covered at that.
Are like monitors included, is available in any of this too? Like infant monitors or anything like that to prevent?
What kind of monitor?
You know, like the monitors you can put in the bedroom or whatever to.
Hadn't thought of that.
Like camera or breathing ones or?
Yeah.
Oh. That's a good idea.
Yeah, that's something you'd have to look at the efficacy. I think there's some
Oh,
questions
of
about
course.
the efficacy of some of that.
Mhm. Okay.
Really?
Type of equipment. There are certain special situations where it might be needed, but as a general rule, I'm not sure that it's been proven to be efficacious.
Really?
I thought you were meaning like those new monitors that they put in car seats that when the car turns off, it'll go off if there's a child in that car seat. So,
Smart.
I didn't know about that, huh?
yeah.
No, I was talking about the more the camera monitors that
Yeah,
you
yeah.
put, you can hear, see.
Mhm.
Having personal experience from 5 grandkids, I think they're great.
Yeah.
Yeah.
And you did vote for that because I signed it. Budget hearings happened yesterday for the 1159 budget. You've already seen it. You approved it. We presented it to the council. No real questions that they had, so that went smoothly, presenting the budget to the council. Of course, they'll continue to review and make recommendations and perhaps ask for changes on the budget.
Were the FEMA staff positions included in that budget?
No, those are under a grant. And then, any questions on the budget hearings? The last thing is just to update you on our contracts that we have with Heartland Community Services. Communication continues to be difficult, and having employees that are under those grants complain that they're not getting any guidance or supervision from Heartland Community Services. I don't know how.
This is an update. I think we see performance issues and we have some concerns over accuracy of some prior charges that we're pursuing, and I've contacted Heartland about. I think you just received quite a bit of paper. I don't know if you had a chance to go through it yesterday. I've not had a chance to see it, but we're at least getting some response to the issues that are being raised. How substantive it is, I'm not in a position to say just yet.
From,
I saw an email from Heartland that said yesterday, I believe.
oh, that was on a question that I had asked a week ago about, so that has nothing to do with what you're talking about as far as the pay.
No, it's a different issue.
It was a different issue, but
I think the question is, do we have enough, is it reached a point to where we should consider termination of the contract?
Do we submit a question, do we have questions on interpretation of the contract?
Well, I mean, it was reached a point where we should terminate our contract.
Well, I think we're evaluating performance issues, not so much in terms of the contract. Is that a fair assessment at this point? At least that's my perception.
I think that there's a lot of issues that are not going to get resolved. And
I suggest you
It's-
let us have to the end of the month. If they aren't resolved, then authorize the commencement of process to terminate the contracts. I mean, I think that's about as much as we can do at this point.
How many people does it affect?
Bye.
So is there options then, if that would happen, to be able to contract with them individually, like done with this, or is that?
That's
a
what
possibility?
I would hope to be able to do, is just have
So
them
you
as
could
Wayne
have the
County
continuation of the
contracted.
services.
We would have a
Yeah,
continuation.
we talked about that last month,
Service.
as much as we have concerns about the quality of service,
Right,
we need a plan B in place.
Right,
You know,
exactly.
otherwise we're shooting ourselves in the foot and hitting the knee.
absolutely, yeah.
Would it be reasonable to entertain a motion that if the current problems we're dealing with can't be resolved and Mr. Cross thinks that we should then initiate termination of the budget, that we as a board support him doing so? Is that an appropriate
So moved.
Second.
further discussion?
Is that what you want?
Yeah, and that's the next step. We'll obviously keep you advised as to where we're going. That may require an executive session based on the nature of the matter. That can be arranged also.
Any further questions? All in favor?
Aye.
Opposed? Okay.
Thank you.
So, anything else?
I don't have anything else.
Old business?
No old business.
New business?
I don't. Do you guys? Questions for me or anything that you wanna see for the next meeting?
Would be August 17th, would be the third Thursday.
Yep.
I did have a question. Is there any concerns around air quality? As I know that we dealt with a lot of, smoke and issues with air quality this summer. Do we need to make any recommendations at the county level or anything like that regarding people exercising outside or, take anything like that when we're having super smoky days? I guess that's something that I kind of thought of
From
recently.
the Canadian
Yeah,
fires?
yeah,
Yes.
the
that came
Canadian,
down?
yeah, the Canadian
Yes,
fires.
sorry
Yeah,
if I
I mean-
misspoke. I apologize. I
No,
need
you
food.
didn't misspeak.
Yeah, there are, reports put out by the state,
Mhm.
that talk about, we're at the heavy or alert or
Mhm.
warning levels. So we could start more closely monitoring those and putting those out on our Facebook page and our website that says, we're in the red zone today as far as particulate matter. That means, everybody, is at risk, because everybody breathes in the air. And the problem when you have PM 2.5 in the air, that's the really, really, really small particulate matters. And you breathe that in and you think, well, it's just like a bonfire. Well, you don't sit, where the smoke is, you move away from the smoke. So when you're in that and you're breathing all of that in, it starts getting trapped in the really small spaces in your lungs. And when you already have compromised lung capacity or comorbidities, heart, that makes your heart work harder, or very young children, that it is, recommendation that you limit outdoor exposure, limit time outside, and especially limit exertion levels when you're outside.
Yeah.
So we could start,
Even just, I just was curious kind of about, folks' concern around it and
Yeah.
education, that part of it.
Yeah. Definitely got a few phone calls that I talked to the public
Really,
about.
yeah.
And, just like the fire that burnt down there, I can't tell the smoke where to go.
Right, right.
You know, but I can't tell you, you know, what happens when you're breathing in,
Mhm.
you know. And this is, you know, wilderness fire, but it still poses, you know, health risks to people.
Any further questions or comments? Is there a motion to adjourn?
So moved.
Second.
All in favor? Opposed? Thank you, everybody.
Thank you.